Hello, ma'am.
Yeah, we can start. I guess.
A very good afternoon to everyone present here. I'm Nisha, the student of Prasanna School of Public Health, MAHE, Manipal, India. It's my honor to welcome all the participants from the 25 different countries to benefit from the 9th webinar organized by the Manipal Health Literacy Unit, also known as the MHLU, in collaboration with the Asian Health Literacy Association, known as the AHLA. MHLU aims to excel in the health literacy resources, policies, and practices. AHLA seeks to understand the health levels across Asia from the research, education, and policymakers' perspectives. Collectively, MHLU and AHLA are initiating a webinar series on health literacy for the healthcare providers, researchers, policymakers, industry, academia, and the public. Before I introduce our webinar speakers for today, I would like to make some small request to all the participants. A small request to the distinguished participants to kindly mute your cell phones and the mic. You may post any queries or questions during the session during the chat box. We will be addressing a selected few questions considering the time limitation. In today's webinar, we will be hearing the insights from our expert on health literacy and climate change. Please note, the speakers will be sharing their insights for 15 minutes. Ladies and gentlemen, it is my honor to introduce Dr. Tao, a distinguished researcher, international program coordinator at Hugh University of Medicine and Pharmacy. Dr. Tao also serves as a General Secretary of the Asian Health Literacy Association, which is the AHLA, demonstrating her commitment to promoting health literacy on global scale. Dr. Tao's academic journey is marked by remarkable achievements. She obtained her medical doctorate degree in preventive medicine from Hugh University of Medicine and Pharmacy in Vietnam, followed by a master's degree in health literacy, planning and financing from Corvinus University of Budapest in Hungary, where she graduated with honors. As a young and dynamic researcher, Dr. Tao has contributed significantly to the various research projects, particularly in the realms of health literacy and digital health literacy, costing, as well as the cost analysis and the climate change. Her dedication is evident in the publication of the 29 original research articles in esteemed international journals, with a notable focus on health literacy. Moreover, as she has delivered over 12 scientific presentations at national and international conferences, further showcasing her expertise and passion for advancing knowledge in her field. Please join me in welcoming Dr. Tao, a true leader and innovator in the field of health literacy and research. Over to you, ma'am.
Thank you so much for your introduction. I think it's a lot of nice words for me currently right now. Thank you so much.
Thank you, ma'am.
Should we follow up my something from the moderator, or should I start my presentation right now? I would like to add Asmarani, right? You are the moderator.
Yes, ma'am, you're audible. Yes, ma'am.
Yes, I think it's your turn to share your PPT first, and I will follow to moderate later.
Okay, thank you. As I am on my screen. I hope you can see my screen right now. Right?
Yes, ma'am, the screen is audible. I mean, we can hear you as well as we can visually see the slides.
Okay, thank you so much. Thank you a lot. And I would like to say good afternoon, everyone from Vietnam. I know that some of you come from a variety country, so I just say from the time in Vietnam. As the mentioned before, I already had some experience about the health literacy fields in the maybe nearly 7 years. And of course, my the main aim is focused for diverse topic with the health literacy, including the health economic or climate change as well. And today, to embark on the journey to explore something regarding to this topic, you can see in my PPT, I had to...
Excuse me, ma'am. Yeah, sorry to interrupt, but it seems that the screen has been stuck for the many participants. The
Sorry.
screen is the screen is still, ma'am. The sharing the screen, it is still.
Let me check it again. Sorry for that. Could you see my PPT?
Yes, ma'am. Now the PPT is visible.
Oh, I'm so sorry for this trouble because I think it's already smoothly, so that's why I talk. Thank you so much.
No issues, ma'am. Yes, no issues. Ma'am,
Yeah,
carry on.
sorry about that. You can see about in the left side here. I have already put something regarding to the climate change, and of course you can see here is the G for the health literacy. We set a lot of organization together, so it seems like the logo for start our present today. Um, okay. The first thing I would like to focus on the critical interconnection between the health environment. And let me divide why we need to understand this connection and why is I call it is crucial for our well-being. You can see here in the concept, you can see. Let's start by understanding what we mean by the interconnection, and this concept underscore of intricate link between the well-being of individual and health of our planet. Exposure to environment issue like such as the population, climate change, extremely heat events, and uh, poor water quality is can negative impact is in negatively to the human health and well-being at the local and national and global scale. And among that, a major factor influencing both health and environment is climate change. For example, from temperature fluctuation and to extreme the weather event and change in disease pattern, and it will play a very important role in the shaping our health and the world we live in. And why we need to understand this interconnection is for academic pursuit. We don't think so, right? It's not for only academic pursuit, academic purpose. It's mostly because it's important, because it's very good for sustainable development and for our well-being at the present and future generation. And we need to take and promote active measures to address environmental challenges and for the sake of public health. And you can see here, I just take the one example from the Straits Times. We usually update the news and the time by some new magazine like this. And the climate change, it affects everything from geopolitical, businesses, migration, food resource, weather, blah, blah, yeah. But the UN, I mean the United Nations, is already had the submit and it bring the world leader and the some people who work in the business to agree on how to lessen this future impact, and they would like to keeping to the 1.5 degree of Celsius limit above the pre-industrial level. And you can see right here, I would like to capture in this straight time because if you know about the culture in in Asia, especially in the South Korea here. Now here is has one sea woman. She usually cut up the the sea cucumber. If you go to the South Korea, you know that a lot of. And right now, due to the warming sea, I mean the climate change, the number of sea cucumber already get lower and lower. So she already said that warming sea means small catches. That is the I would like to affect to other food sources. And here you can see we have the very nice picture here. You can see here is the where is wasabi blend. If you know wasabi is similar in the Japanese cuisine. And of course here, why would I like to mention here? You can see in the picture the wasabi used for the Japanese cuisine, and they use the roots of the wasabi It's very expensive, I think, if you try the real taste. But due to the wasabi with blackroot and it's due to the rising temperature, normally, if you know that it's a very good if you around 20 or 21 degree of Celsius. It's about the 70 degree of Fahrenheit. And in the recent year, you know, in the South Asia and nearly, we already wait for face to the very high temperature, nearly like 100 degree of the F, or maybe it's near the 37 degree of Celsius. So it leads to the crop model substantive to the mold and disease. It's a made for the wasabi cannot use and it's not good quality. And the next thing I would like to mention about the climate change is threatening to the future of Winter Olympic. If you know, here is the picture from the Olympic in the Peking in the China, okay, at the Beijing in China, and they need to use the artificial snow for the national high ski standard. Uh, and here is some risky for some risk and is risky action for the people because if you fall it is a harder surface, so it's make you more risky, more and severe the injury when you fall and when you action and play the game. And of course you need to pay more, you lose your cost, and of course is can at night a lot of people can being faced to the harmful due to the local wildlife. Yeah. And go to directly impact on climate change on health. This is a good source. I already think it's a very good source to share with you about the impact together. When climate change, it's already lead to the increase the crop loss, food price, and make our food is not security, and lead to some existing chronic disease. Of course, it's direct make the increase the incidence of infectious disease. You know, for example, in our Asia country, we need to usually face to the like dengue fever, for the TB, for the malaria or some other disease, and of course for like it's already linked to the mu stress and distress due to the high risk to coping behavior. And of course, it leads a lot of things. For example, nearly time you can see we already had a lot of like natural disorder, more flooding, more hurricane, and it's impact directly to our respiratory disease. It's like and if not, it good for our health. And here is a systematic review in the South Asia. Spencer focus on Vietnam, Laos, PDR, and most of the South Asia. And it's already mentioned about the health risk in climate change on like common health impact to the disorder like death, injury, traffic accident, blah blah. Yeah, including child health and mental health problem, as I already mentioned. And of course, with the high temperature, I already take with you some example. It affect to our food safety, but it will link to our will go to more mortalities and hospitalization, particular infectious disease and cardio. I know we are know about it already, but you don't know how much they impact to. And dengue fever is most sensitive to climate change variable. Like currently right now, for example, in the place I am living right now, due to the climate change, we don't have lots of the cold weather. So compared with the in previously, now we already had with the 1 degree of Celsius rise increasing temperature, and it's in fact to the human for the elderly as well. And we face to some dengue fever in Vietnam right now. And some data on climate sensitive infectious disease is already not available. It had to say lacking. So that is what we currently now didn't know exactly about this. like the waterborne or foodborne disease. But the near future, more research will focus on this field as well. This what I think is really good to understand more about the linking between them. And due to that, we need to have the action. We should to action right now, because if you United Nations lead to some to fight the climate change and what we already know in the world. Because they work a lot, but maybe we didn't know. So I would like to share with you. If you already know, we will know about some other aspect as well. Here is the Sustainable Development Goal. It had the if you know about this before, it has 17 goals established by the United Nations, and in the 2030 agenda for our near future as well. And primary, they focus on a lot of kind of diversity topic for economic and social affairs. You know. But here I would like to focus on the 13. And it's a climate change action. You can see in the center here, or maybe you can see it's in green color here. Okay, and it linked to the we have a lot of thing, and it linked to other GDF. So we need to link. For example, you can see here is a strengthening religion and adapt for capacity of the climate change related disorder. So is a in fact affect to the poverty for the like the zero hunger, and of course for the development of the society. And I think you can spend time to read more about here, and I will moving on next, because I think the next thing is really important. When we talk about the United Nations, you need to know, if you would like to focus on the topic in deeply, you need to know the United Nations framework for convention on climate change. Here they have near universal membership, like nearly 200 parties right now. And it's very first successful in Berlin, the first conference in Berlin, Germany. And they have some parent treaty. And I would like to share with you here, because maybe it has very interesting here, like inspiring agreement. They agreed to keep the global average temperature rise in this century as low as possible to 1.5 degrees Celsius above the pre-industrial level. If you know about this before, I think right now you can living in the, we need to be for the high temperature more than in previously. So that's why they already agree about this. And about the COP29 as well. If you have time, please take something to know about this knowledge, because I will link with you about how literacy can improve about your knowledge in climate change, and after that you will have more knowledge to action. You know, if you lack up the information, the basic information, I think we need time to spend time to more about this information. I think regarding to COP29 is in Dubai, UAE from the 2023, and it's already for a lot of things. We need to commit together, and it's already include the global temperature right here. They would like to do it together at the same what the 2015 Paris Agreement. You can see here. So that's why we need to continue and update about, and we need to action. Talk about health literacy. I don't know how about, we already had, here is the ninth webinar. So it means that you already have some background about what is health literacy and something blah blah. But I would like to mention about you two very key definition. First is when you talk about health literacy, is would like to mention about the first is personal health literacy. Is the degree to which individual have the ability to find, understand, and use information and service to inform health-related decision and action for themselves and others. And the second definition you need to remember is the organizational health literacy. What does it mean? It's a degree to which organization equitably enable individual to find, understand, and use information to service informed health-related decision and action for themselves and others. That is two key definition we needed to remind and just a short remind to you on. And I just would like to mention about health literacy is the critical determinant of health. It's already written in a lot of book and the publication. And the citizen have the right to be informed of the potential risks and benefit to the health. And the empowerment of the people is closely linked to the level of general literacy and the level of the critical health literacy. So to implementing the SDGs, we also require the high levels of health literacy among the decision maker and actor in the sector other than health. And if you understanding about the health impact of the climate change, you give action and you can be informed about decision making, including you turn off one light in your house, or maybe you can prevent yourself. I will give you some example after this slide, but you can know about how why we need to have some successful example when you improve health literacy. And finally, if health literacy empower individual to take preventive measures and advocate for community resilience. So from my side, I suggest to we navigating the health literacy in climate change in 3 points. Third, the first is health literacy empower individual to understand and address climate change related to the health risk. Secondly, I assume that clear communication strategies are crucial for bringing the gap between the scientific knowledge and public understanding. For example, like now today, we talk together, but if you understand some, some idea, some knowledge from today, you can share with your public general. You share with your family, you share with your friend, you action together, you share with your community. I think it's a very good strategy. And the third point is successful health literacy campaign will provide the model for effective communication in the context of climate change. Because the climate change already appear, so we need to face to, we need to adapt it, right? I will give you 3 examples for the successful health literacy campaign related to climate change. And the first one is the focus on the CDC. If you are working in the health perspective, you will know what is CDC. It's called the Centers of Disease Control and Prevention. And CDC campaign already effectively communicate with the health risk of extremely heat event. You can access the website here. I just already capture the screen, and you can see they already mentioned a lot of strategy. And the one of most of them I think is very good to read is BRACE project. BRACE framework is allowed to the health officer to develop the strategy and program to help community prepare for the health effect of climate change. And here, if you access to BRACE, it has the 5 steps. The first step is anticipate climate impact and accept vulnerabilities. You can explain more, but I think it's more focused on climate impact and access to the some people like the elderly, the child, the people with the like chronic disease, cancer, something they will focus on the population like that. And the step 2 is a project in of the disease burdens. They will estimate and quantify the additional burden of the health outcome, and it's associated with the climate change. And step 3 is talk about the accept public health intervention. They identify the most suitable health intervention for the identify health impact of the greatest concern. Step 4, they would like to focus to the developing and implementing of the climate and health adaptation plan. And I already mentioned with you on, we need to adapt with climate change and prepare something for our future. And step 5, they evaluate impact and improve the quality of activity. Like they evaluate the progresses, they determine the value of information attained and activity undertaken. And the next one is example of how the interaction online module engage to public in understanding and prevention vector-borne disease. What you know about vector-borne disease? To be honest, I would like to interact with you on, but because I share my screen, so I didn't see exactly about your question right now. But I think if you had any question after that, we can explain more and talk about the vector-borne disease. You know, in Asia Pacific, especially, it's had a lot of kind of like this disease, and this model and the WHO, World Health Organization, they had the 4 approach to engage the community participation. The first, they switch to community oriented. Next, they switch to community based. Everything you need to base on the community, and like the intervention inside of the community or some external support as well. And next, community will manage the progress, and they can decision about the people themselves with or without the internal support of partner. And finally, the community out. It seems that the community accept are fully mobilities, and the community will empower it to develop system for self-governance, establish and set priority, implement the intervention, and develop the mechanism of health promotion with their partner, depend themselves. So here is a very good source you can read about this to improve the community knowledge and action as well, based on the 4 approach approach to the community engagement. And I don't know how many people here they know about One Health, but it's very popular in our country and around Asia right now. It called it the One Health. We think that successful public health intervention require cooperation of the human, animal, and environmental health partner. We do it together. And here,
Hello, Ma. Sorry to interrupt, but only 2 minutes are left for the session.
yeah, thanks.
Yeah.
And here, we already know about this, and you can see environmental health here and human health is seen together, has some effective I already shared with you on. And regarding to animal health, it's including it's called One Health. And One Health issue include emergency. And if you focus on the topic, you can see a lot of diversity topic already focused on climate change and the health threats shared by the people and the environment. And the key message today focused on to improving health literacy, and we should work together because it's good to community can prepare for and respond to the critical health effect of our changing climate. And if you go through to the CDC page, you can see if you work together, every people can have together. Like the media, they give report the health impact in our community. The meteorologists, they provide the exactly information to available community to know exactly about the evacuation shelter and cooling center, like that. And local health department, they can have to monitor and identify, provide exact information to the community and work together with every partner to prepare. And the healthcare provider, they can help to educate patients and develop the emergency response plan for the extreme weather. Regarding to local organizer, they can help to a lot of kind of thing like here, work with state and government to prepare and a lot of plan develop to long-term adaptation plan. And for the school can have a lot. School can teach for this purpose and teach for the student as well, provide the exactly the safe work student to during extreme heat, a lot of kind of thing. And finally, it's community-based group. They can have a lot work together. And if you you would like to focus to this topic, you should read this article. I just think it's really good, and you can have the definition of climate and health literacy. And near future, we will focus on to develop some tool to you to you can do in research, and if it's good, we can conduct in some survey in the near future. And thank you very much for your listening. If you have any question or concern or something would like to share with us, please feel free. Thank you so much.
Thank you, ma'am, for sharing your valuable insights on the topic. Now I would like to invite Meliantha Asmarani, who is working as a secretary of AHLA, Indonesia Country Office. Currently, she's working as a secretariat of the Faculty of Medicine in the University Dian in Indonesia. Will be the moderator for today's panel discussion. Over to you, ma'am.
Okay, thank you so much, Nisha, and thank you so much, Dr. Tao, for the important insight that you shared today. And hello, everyone. My name is Meli from AHLA Indonesia Country Office. It's such an honor to be here. So thank you for Manipal Health Literacy Unit and AHLA that giving me a chance to be moderator on this panel discussion. And now we will talk about the subject of our discussion today. It's health literacy and climate change. And I invite you to drop your questions, comments, and your opinion on the chat box, or just simply press the raise hand button so it will be easier for the speaker. But I apologize if I can't respond all the requests because we have limited time for this panel discussion. So we are aware that the effect of the climate change is not only affecting our environment, but it also has impact on health consequences. And I want to open the discussion today with Dr. Tao. If we talking about the climate literacy, we believe that the expertise have their own role to fight this issue. And it will be a huge subject to talk about. But I want to highlight the educational sector that include in one of the point of the UN climate actions that you shared before, because we have the resources like the teachers, lecturer, or maybe the activists, and also the children who have been educated well about the climate change can encourage their peer, their parents, so it can bring change in society. And it might have a big impact, and it considered as a valuable investment and affordable solutions that we have. But I know it's not as simple as it hurts, but still, if we can promote about the climate literacy at educational sector, it can be impactful. But these conditions can be separate from the literacy level of the educator itself, like what you said before. Do you have any information to share with us about the current conditions issue at your place, or maybe about the actions or policy related about the climate action, Dr. Tao?
Thank you so much for your question. I think it's a real is a good question to explain more about that perspective. I will share you about one example from first is one example from my country, Vietnam, and the secondly is one example from what I already know in around the world. The first is focused on Vietnam. In our country, when the people they study at the high school, we already add about the film climate change onto the textbook, and now through that we already know about exactly what we would like to mention for them. But everything just in the it seems like theoretically. because they just study, and some of them had got high score, but without action, so they already forgot when they wrote. And after that, when they being the if they being the university student, you still they still, for example, being in my university is medical university. Of course, medical university, we don't need to focus more about climate change or environment health, something like that. We just have very small credit for them, yeah, during the 6 year. But our students still have some join some volunteer campaign to prevent our environments, not only in in the magazine, not only in the broadcast, but they need to action together at the volunteer activities. And also after they join in some conferences like this, health literacy, and we will spread in country now, create some workshop and invite some speaker. They good for the action for the not only health literacy, but prepare and transform a lot of like the COVID-19, what is that, and what did they say, they how they can apply for Vietnam, and what did in our city already had, for example, like that. And in Vietnam, if you know, we have the one very big group is called it Vin Group. It is a second, yeah, it's the second company of the world to produce the electrical car. It seems like the one action for the safe our in environment as well. That is example from Vietnam. And in the world, I think we have a lot of things to share, but as I know about in Europe, yeah, we usually work in some international health literacy association there, and they already put the write a lot of book and put it in for the university level and high school level as well. So I think every people already action, and they would like to make the young generation understand and action together. So I think not only from ourselves, and for when I know that I will be in the presenter today, I think what should I can share with you on. I think we had lots of topic to talk, but I would like to choose some key points and share with you some sources. And after that, you can take a look again and have the deeper knowledge by yourself as well. Yes, that is what I would like to share with you. Thank you so much for your questions.
Okay, thank you. For anyone in participants, do you like share with us about, okay, we have one from Jyoti. Can you see on the chat box, Dr. Tao?
Yes.
Okay.
How can we educate climate change to general public away effectively? Yeah. Could I don't know whether the participant can unmute themselves, because I would like to ask some question to say about this.
I think they can. Jyoti, can you
Okay.
unmute your mic?
I would like to focus where you come from and what did you already done, for example, like that. So after that, I can share the way what we already apply in Vietnam and how the world already applied that I already know. That's why I would like to add about that. Thank you so much for your question.
Jyoti,
Because
can
I
you
don't,
join with us?
yeah, because I don't want to share something general. Okay. If
Okay.
no, I just say something general, and if you would like to give more detail, you can send email to me. Okay. And now because you haven't mentioned about where you come from and what did you already done, so I would like to just focus on the we apply to go to the the textbook, the first thing. Secondly, I already shared with you a four approach of the WHO about the methods for the community. They can powerful. They give the commitment, and they can do manage themselves. So they action, because it's just the theory, but we already apply it for one the big research in our community, and I think it's work. Because we would like to prevent the dengue fever in our country due to the climate change. It affects a lot of due to the heat. Yeah, so we already apply, and the people, they already know exactly about they health condition, and they know they can engagement, and after that we already had it. And if you would like to give more detail about our project already, you can send directly via my email. I can answer you detail, and if you can apply in your place, I think it's really good as well.
Or maybe Dr. Tao, you can type your email to the checkbook. So maybe if anyone want to send a message or send a question, they can send it directly to you.
Yeah, thank you. I will send it because I think the audience already had this before. Thank you for your reminder. Here's my email.
Okay. So Jyoti, if you have any questions about your topic before, your questions, you can send the email to Dr. Tao. And I think, did we have any time, Nisha? Did we still have any time?
No, ma'am, we are always almost at the end of the discussion.
Okay. So the climate change is it's really complex to discuss about. So it's not only one sector, it engages that more one sector they should uh prepare for this subject. So we have finally come to the end of the panel discussions, and I hope it find it informative and valuable. And thank you so much for joining the panel discussions. And for this time, I give it back to Nisha. This time is yours, Nisha.
Thank you, ma'am. The panel discussion has concluded. That means which we bring us to the end of the session. It has been an honor to be a part of such a wonderful event. On behalf of MHLU and AHLA, I would like to extend my heartfelt thanks and gratitude to our esteemed speakers, moderators, faculty, staff, and students of MAHE, the members of MHLU, Executive Board, and the members of AHLA. In the end, I extend a heartfelt thanks to Dr. Asha Kamath, in charge Director of Prasanna School of Public Health, MAHE Manipal, India, and administration of MAHE Press and Media for the support we have received. I have not mentioned the names, but many thanks to each and every one of you who has contributed directly and indirectly for conducting this webinar. Thank you all.